So, dear students, today we will study about the topic that is the inflammation. And let me go to the next slide. First of all, we have to understand that what does this inflammation word means. Okay, as it has been written that inflammation is the response of living tissue to the injury to any agent. Okay, so in any other word, we can say that inflammation is basically a protective response to rid the body of the cause of cell injury and the resultant necrotic cell that cell injury produces. Okay, so in short, we can say that inflammation is basically a natural response of our body or our living tissue, okay, against the injury. If any kind of injury occur, whether it's a chemical injury, mechanical injury, or any type of injury occur, our body tries to get rid from it, and the entire mechanism work behind it, okay, that is termed, and entire mechanism work, when it mechanism work, it shows some time of response in our body, that is termed to be as inflammation. Okay, so in this inflammation can be caused by different reasons. First one with the infective agents like bacteria, viruses, and then parasites, physical agent like heat, cold, radiation, the different mechanical trauma and different reasons could be there. Then chemical agent like organic and inorganic poisons, immunological agents, cell mediated, antigen antibody reaction, as well as inert material such as foreign body. Okay, so these agent, okay, may cause different type of radiation, different type of inflammation inside our body. Okay, and these are the cause for the inflammation inside our body. Okay, like microorganism, then comes the mechanical trauma, if we fell down, or if we met an accident. Okay, all these may lead to the inflammation. Then comes what are the clinical sign of inflammation. Okay, so in inflammation, as we all know, that it has been divided into two portions, that is the acute inflammation as well as the chronic inflammation. So acute inflammation basically has been divided into five different stages. The first one is the rubor. Okay, Latin word it is, that means red discoloration. This occur because the capillaries are filled with more blood than usual. Means whenever the inflammation occur at any place, the color of that place, generally skin or the organ, become little bit more reddish in color. Why? Because more blood reaches at that place, and ultimately the capillaries, the blood capillaries are filled with the blood, that gives us the red coloration, which we call it as rubor. Then the next one is the tumor, that is termed to be as the swelling. Okay, this is caused by buildup of fluid. So the fluid accumulate in the nearby cells and the tissue, that causes the swelling in that area. Then the pain is there. Pain occur because the pains nerve which are present in those area, ultimately they get activated because of the inflammation, and ultimately it sends the message to the brain that we are, that at this place the inflammation has taken place, and the amount of pain generally can give information that what type of injury it has occurred. Okay, mild injury means mild, you can say the stimulation of the pain receptor will takes place, so the brain will sense the mild pain over there. But if major injury is there, major pain, so maximum nerve, pain nerve will get stimulated, so the intensity of the pain which will be perceived by the brain will be very much high. Okay, then heat will be generated and more blood flow to the affected area, and because of you can say that rapid movement of the blood in that effective area, that causes the increase in the temperature in that area. So when we put our hand on that area, inflamed area, ultimately we get a warm sensation. Then loss of function. Loss of function, it does not mean that it is a permanent loss of function, rather it is a temporary loss of function in that inflamed area. Suppose I fell from the bike or somewhere and I get hit in my leg, so inflammation has occurred in my leg. So when inflammation will takes place inside the leg, ultimately temporarily for 1 day, 2 day, 3 day, there will be swelling, redness, pain in my leg. Later on, as it will subside, I will take anti-inflammatory medicine, it will subside, ultimately my leg will recover, and loss of function, temporary loss of function will be recovered, and person will gain the full recovery, and the organ will again start performing as it was performing earlier. Okay, then chronic inflammation, when this acute inflammation is not treated, ultimately it will convert to the chronic inflammation, inflammation, causing the fatigue, mouth sore, chest pain, abdominal pain, fever, rashes, joint pain, and different other problem will start in our body. Okay, so when the inflammation is in acute condition, it should be diagnosed, and immediately we should take some medication like anti-inflammatory medicines and other. If it is caused by microorganism, we should take antibiotic, antiviral medicines in order to kill that microorganism, so that ultimately the acute inflammation can be treated. So in this context, we have to identify all these cause, and then we have to act accordingly to reduce the inflammation. And type of inflammation, as we have as I've discussed earlier, it is of two type: acute inflammation, which is in this type of inflammation, it start rapidly and becomes severe in a short span of time. Okay, immediately when we get the injury, immediately the body start reacting, showing some response, that is redness, swelling, pain, heat, and temporary loss of function. Okay, so the main feature of acute inflammation are accumulation of fluid and plasma at the affected site, intravascular activation of platelets, polymorphonuclear neutrophils as inflammatory cells. Then what are the causes? Causes may be infection, trauma, physical, chemical, and all those stuff. And outcome of acute inflammation: resolution limited, tissue damage, cells at site able to regenerate, chemical substances neutralization, and lymphatic drainage over there. Then chronic inflammation, this refer to long-term inflammation and lasts for several months and year. When the acute inflammation is not treated immediately within 1 day, 2 day, one week, ultimately slowly that inflammation, first the redness will be there, pain will be there, and then that redness, from there, if the microorganism will be there, ultimately it will be causing the those microorganisms will develop the colony, and it will destroy the much more cells, more cellular destruction will take place, and ultimately the pus formation may take place, and slowly the chances of development of sepsis may be there. So that may cause the permanent loss of some of the part of our body. So if the that is acute inflammation is not treated well, okay, not diagnosed, ultimately it will lead to chronic inflammation. And causes of chronic inflammation mean persistent infection for long interval of time. If the infection remains in our body, like tuberculosis, will last for around 6 months, we give the medicine for at least 6 months, minimum 6 months to 9 months. Okay, so if that period for 6 months continuous, the mycobacterium tuberculosis is present in the lung of that patient, but he is not getting treatment, probably that acute inflammation of the lung may get converted to the chronic inflammation. Then immune mediated autoimmune disease, autoimmune disorder. Okay, different diseases are there which are autoimmune disorder, like myasthenia gravis is there, rheumatoid arthritis is there, ulcerative colitis, in which our immune system misread our own body cell as an foreign substance and stimulate the T cell and the B cell. And T cell is stimulate when T cell is stimulated, a helper T cell is stimulate cytotoxic T cell. At the same time, it also stimulate the B cell to produce plasma B cell to produce the antibody. So the cytotoxic T cell and antibody, they both launches the attack and causes the inflammation inside our body. And then persistent exposure to injurious chemical like silicosis in the lung, atherosclerosis in the vessels. So those person who work in an industry where harmful chemicals are there, like paint industry or the asbestos industry, so continuous exposure of these chemical or these substances may cause the inflammation, internal inflammation, which the person is not aware, and his any of the visceral organ is getting exposed, and there the inflammation he is getting slowly, then inflammation is increasing, but he is unable to get those, he is unable to identify that actually he is suffering from this type of inflammation. So later on what will happen, that acute inflammation will get converted after 2-3 years of exposure, it will get converted to chronic inflammation, and that will be responsible for the disease or permanent loss of the function of any of the organ. Okay, so this is about the causes of chronic inflammation. So that's all. Brief summary about inflammation: what is inflammation, what are the different types of inflammation, and what are the symptoms of inflammation. Remember, the key message, the takeaway message from this topic is that inflammation is the response of the body which the body shows after it get injured. And the second thing is that the symptom which are there, that are known as the 5 symptoms are there for acute inflammation, that is redness, swelling, pain, heat and the temporary loss of function. And chronic inflammation, if acute is not treated, it will convert to chronic. Okay, and so this is a basic summary of the inflammation. Thank you all.